So part two of the skull is going to focus on the facial bones, and there's 14 facial bones that you need to be aware of. And again, remember that cranial bones are defined as being in direct contact with the meninges or the brain. And so the facial bones really just serve as attachment point and for muscles and kind of structural support. So the 14 that you need to know are the vomer, the inferior nasal concha, the nasal, maxilla, mandible, palantine, zygomatic, and lacrimal. You may notice that there aren't 14 bones there, but most of them are paired with the exception of the vomer and the mandible. Both of those are singular bones. And the mnemonic device that you can use is Vigo cannot make my pet zebra lunch. Yeah, there's no really ones that kind of stand out. You can Google search them to see if you can find one that you identify better with. But vomer, inferior nasal concha, nasal, maxilla, mandible, palantine, zygomatic, and lacrimal. There's the lacrimal, maxilla, mandible, nasal concha, zygomatic, nasal, and that's it. All right, so the vomer, we'll start with that one. So Vigo, right? It's kind of forms the inferior half of the nasal septum, so right below the ethmoid. And this kind of looks like this blade. Vomer itself means plow, so it's kind of, if you're a farmer, that might strike a chord with you, but it's this blade-like structure that sits just below the ethmoid. The inferior nasal conchae we've already talked about a little bit in the sense that it serves the same function as the superior and middle nasal conchae that are structures on the ethmoid. It just forms as a separate bone. The nasal bones, these are going to kind of form the bridge between the two orbits, your two eye sockets, and really, if you ever get punched in the face, the cartilage is going to, if you ever break, if you actually truly break your nose beyond just the cartilage, you're going to break these small bones, these nasal bones that sit at this kind of the top portion or the superior portion of the nose. Okay, so as we're working our way down to the maxilla or the maxillary bones, these are going to form the upper bone or the upper jaw, and they're shown here as actually bone colored. There's a couple structures that you should be aware of. Right? So the actual part of the teeth or the maxilla bone that hold the teeth is called the alveolar sockets. All right, so those are the holes that the teeth sit in. The little points in between the teeth are called alveolar processes. So these are the bony points between the teeth, and the sockets are the ones that actually hold the teeth. Again, these are going to form a portion of the orbit, and the only other structure that you kind of need to be aware of is what's called the infraorbital foramen. So again, we'll pop up when we start talking about nerves in the brain, but infraorbital foramen is where a portion of the nerve, one portion of a nerve comes out. All right, infra, like inferior, means below, orbital means orbit, foramen means hole. So these are the holes below the orbit. The interesting thing about the maxilla bone is that if you look kind of at the underneath, so kind of a bottom image of the maxilla, you can see that fine line that sits, that connects, or where there's the two maxillary bones fuse on the upper portion of the jaw. And so that actually forms the anterior 2/3 of the hard palate. And so again, I'll repeat that, the anterior 2/3 of the hard palate. So this is the bony structures, and then this is the front 2/3 of it. And it's important that it's hard here because it allows you to enunciate, to say the T's and the the S's and the words that you're using to push your tongue off of a hard substance, and allows you to enunciate. if you were to use, you can go all the way back and feel the soft palate, like that soft tissue, right, you wouldn't be able to enunciate nearly as well. The other bone that forms the last third of the anterior palate is the palatine bone. And so we'll talk about that when we get to palatine in terms of cleft palates, what that actually means. But it's kind of interesting to feel the difference between the hard palate and the soft palate. Okay, so the mandible, this is a structure, this is forming basically your jaw, and there's a couple of structures that you need to be aware of. The first one is that the mandibular condyle, right? So a condyle, again, is going to be this knuckle thing. It's going to be a ridge of articulation. It's articulate with the mandibular fossa, and if you remember, that's located on the temporal bone. So the mandibular condyle articulates with the mandibular fossa. And those things are, that mandibular condyle is located on a structure called the condyloid process. All right, so condyloid process, mandibular condyle. The other structure is called the coronoid process in the front, right? So look at that root again. You're going to have that crow's beak, right? So it's going to make that pointy structure in the front versus the curved condyle in the back. Again, you're going to have alveolar sockets and alveolar processes, just like you did on the maxilla bones or maxillary bones. Then you have a couple more foramen. You have the mandibular foramen, which sits on the inside of the mandible, kind of sits posterior and interior, medial, on the jaw. And this is where the trigeminal nerve, or portion of the trigeminal nerve, comes out. And so if you ever had a cavity and they've done drill work, you often get Novocaine shot into that back portion. What they're aiming for is to reduce the sensation for the trigeminal nerve. So they're numbing that nerve, and so you won't feel pain. The mental foramen is the mental means chin or towards the chin. Ment means chin. That root tal, T-A-L, means towards the chin or towards. And so the mental foramen are holes that are towards the chin or anterior on the mandible. Right? And so you have a facial nerve part comes out of this. And this is why they've kind of made this transition from regular dentists doing wisdom teeth removal to specialists, right, to orthodontists. It's because if you damage that facial nerve in any which way, it's more of a liability if you're not a specialist. And so you damage that facial nerve, you're talking about severe facial paralysis. All right, so just real quick going over those things, the jaw again, the mandible. You have the mandibular condyles, which sit on the condyloid process. The other process is the coronoid process, and in between the two is what we have a mandibular notch. All right, so mandibular condyle to the condyloid process to the mandibular notch to the coronoid process. And so if you recognize coronoid process, that's something that we've seen before. And so we have a little spelling test for you. You have a word bank at the bottom to kind of pull from. But where do we see these things? All right, where do we see these roots? So the coronoid fossa, where do you find that? If you said the humerus, you are correct. Remember, coronoid fossa, not process. You got to look at the whole world. So the fossa is going to be that hole on the kind of the front portion of the humerus that's going to allow for the coronoid process on the ulna to articulate with it. The conoid tubercle, you remember that that's on the clavicle. The coracoid process. Right, where do we see a coracoid process? Said scapula, you are correct. All right, so you remember that the coracoid process and the acromion process are the two processes on the scapula. Condyloid process. Kind of, hopefully you just got this one because we just talked about it. That's on the mandible. Right, that's what the mandibular condyle sits on. Last one, coronoid process. I already mentioned it once in the ulna. It's also, again, on the mandible. So make sure that you're specific on saying where these things are. A couple more bones to go over. The Palantine. This is an L-shaped. If you look on it, you can see that posterior view. It actually looks like an L. And this is going to form the posterior third of the hard palate. It's in kind of neon green and then yellow in the actual orbit. So again, this is, like I just mentioned, it's going to form part of the orbital floor. So all these kind of facial bones, more or less, form part of the orbit in some way, and we'll kind of hint on that. We'll touch on that a little bit later. So zygomatic bones, we've already talked about the temporal arch, or excuse me, the temporal process of the zygomatic bone, in the sense that it makes up the zygomatic arch with the zygomatic process of the temporal bone. And so you just got to talk it out. Sometimes these kind of look like two little hands shaking if you look on it straight on. So they're going to, again, form a portion of the orbit and also the anterior portion of your cheekbone. Lacrimal, if you hear more commonly known as your lacrimal fossa, or excuse me, the lacrimal fossa is more commonly known as your tear duct. So lacrimal bones is dealing with tears, and so this is you can actually see the hole that sits between the lacrimal bone and the maxillary bones, and these form that duct, or that hole that sits in there is actually where that connects a good portion of the inside of your skull. Okay, so we've kind of hinted at some of these bones already being part of the orbit, but we want you to be able to identify all 7 bones of the orbit. So this image is a good image to kind of study and be familiar with, right? We're looking at the anterior left portion of the skull, and if you work your way using the mnemonic device, it's pretty straightforward, and it kind of spirals in. So it goes, my friend Zeus likes eating spicy pizza. All right, so we start with the M, the maxilla, then we go frontal, zygomatic, lacrimal, ethmoid, sphenoid, and the little tiny guy is part of the Palantine. And so work your way through and spiral in, and again, it's not too tricky. Remember that the sphenoid takes up a good portion of the back of the orbit, and then just anterior to that is the ethmoid. All right, so those two things make up a good chunk of the back of the orbit. And one last thing, I hit it pretty heavy, but if you look at what the roots of these words mean, it makes it a lot easier to figure out why they're named the way they are. It's one thing just to memorize it, but if you understand what the words mean, it makes it, I think, a lot easier.